going to be a walkthrough of the cardiovascular section of the 2022 CPT manual. It's going to be a fairly quick walkthrough, and I want to warn you about that because I'm sure if you've looked at this section before, it might be a little bit overwhelming or intimidating, but I want to promise you, I'm not cutting corners here. We're going to go back through and talk about what you really need to know from this section and how you should approach answering questions from this section on the national exam. So let's get started with it. As always, I've got my tabs, I've got my highlighters, my pen, of course. So we are going to look at the cardiovascular section, which starts on page 239. So like all the other sections, we do have this great table of contents. This section has a very detailed table of contents. And that is because, as you can imagine, the cardiovascular system is extremely complicated. But there are only two main sections, and that's heart and pericardium, and then arteries and veins. Okay, but as you can see, there's a lot of subsections. Okay, and most of these are going to be very specific procedures. There's a couple that are just related specifically to structures, like you see pulmonary artery, and there's just a subsection for the pericardium. But most of it is going to be very specific procedures, such as grafts, reconstructions, injections, certain things like that. So as you can see, it's really, really specific. So if you are working really heavily in this section, you will be able to identify the exact procedure or type of procedure that you are doing just from the table of contents. Another thing I wanted to point out was we do have some really great illustrations here, and that includes a lot of information about the different veins and arteries. Here on 242 is where we have our arteries, they're in red, and our veins are on the next page in blue. And these are listing all of the major structures of the arteries and veins. These are really helpful, specifically if you are working in those sections heavily. It really helps you visualize what you are doing. Another a little strange thing about this section is it's not exclusively covering the cardiovascular system. We also have the hemic and lymphatic system covered here. This is another section within the cardiovascular system, but we will study it separately, okay? So we have the hemic and lymphatic system, and then also the mediastinum and diaphragm. So these procedures are listed within the cardiovascular table of contents, but they are their own systems technically. And we will look at those later, but I did want to show you that that is what is listed here in the table of contents as well. Again, some really excellent illustrations here too. All right. So on page 247 is where we get started on the actual procedure codes. We do have some guidance here as well. It's always good to read the guidance, particularly if you're working a lot with that section. But something that is a little bit unique about the cardiovascular section is these codes have a lot of parenthetical guidance. So anytime you see these parentheses, they're going to be very important about the use of that code. And what I do want to point that out to you and encourage you to, if you don't highlight all of them, at least do something to draw your attention to those parentheses, because what you might see on the national exam is they give you a scenario in which this is the right code to use, but then they pair it with one of these codes that you are not supposed to pair this code with. And so that would be an easy way to either make a mistake or eliminate that option from the multiple choice, okay? All right. And then we get into pacemakers and defibrillators, implantable defibrillators on 248, and there is a ton of guidance here. I'm not saying you don't need to read it, but unless you are working extensively in this section, it might not be worth your time while you're preparing for the national exam. What is important to know when you are coding scenarios that are dealing with these products like pacemakers or implantable defibrillators is the details of what type of product is being used. Are there dual leads? Are there multiple leads? Are they temporary or are they implanted, which would mean they are permanent? Okay. Another thing that would be important to note is the location of the placement. So these would be atrial, ventricular, or atrial and ventricular. And so like we've seen in some previous sections where we have a primary code and then these indented codes underneath just specify a little bit different location or provide a little bit more context. You will see that as well with the defibrillators and the pacemakers. Okay, so I would go through here and make sure, again, we do have a lot of guidance as well in the parentheses, but also make sure we know, are we doing temporary and or permanent? How many leads are being used? And what is the location in which it's being placed? Okay, so that's what's important for the defibrillators and the pacemakers. And I mean, I'm not going to have the opportunity to go through all of this and highlight everything that you may want to, but it's important to know that. So you may want to just make a note for yourself somewhere, possibly over here, and make sure you know leads, type, and location. And that will really help you narrow down the correct code from that section. All right. So we're going to look through here as well. Again, you will see a lot of parenthetical guidance here. My recommendation is anytime you use one of these codes, say you're working in a workbook or a practice test or something like that, you do use one of these codes, learn whatever you can from that situation, highlight what you need to, make notes that will help you with that specific code. And that will help you when you're coming back during the national exam to say, oh, this is how I needed to use it in this context. And that'll give you a little bit broader understanding for that whole section. We said there are a lot of codes in here. And then we get into different valves, the cardiac valves. So these are the valves of the heart. And what you're going to see in these sections is, like we've seen in a few other sections, I'm thinking musculoskeletal, but some of the others as well, maybe the integumentary as well. What you'll see is you have very, very similar codes, but the only thing that is different is which part of the body or which part of that structure we are looking at. So all of these codes are going to be for the aortic valve. And then these codes here on 261 will be very, very similar, but they are just for the mitral valve and so on and so forth. And then we've got pulmonary and tricuspid as well. So that's what's important to note there. Whenever you are working with valves, make sure you know which valve you are working with, okay? And that's going to really narrow it down, because what you'll see on the national exam is they will pick the same code or a very similar code from this section, and then one from the mitral valve section and one from the aorta that are all really similar. And the only difference is which valve you're working in. So you just need to pay attention to that. That'll help you really narrow it down. To quickly go through here, and I know this looks like I am rushing through. I promise you I'm not, but I want to make sure there's nothing super important that I need to point out to you. We do have heart and lung transplantation here. That can be important. Again, you're going to see sections with a lot of guidance. You don't necessarily need to review this before you are preparing for the national exam. But if you are working in this section extensively, then you will need to likely get very, very familiar with what you're talking about here. Okay, so I think that's all I want to talk about specifically from this section. And I can post additional resources that'll help break these things down a little bit more. But I want to talk about how to handle this section specifically on the national exam, okay? So I think when we approach the cardiovascular system, we all have a tendency to get a little bit anxious. It's kind of overwhelming. And that's because this section is just so complicated, right? However, I want to reassure you that if you are preparing to take the national exam, you do not need to be a cardiologist. You do not need to understand all the disease processes. You don't even really have to understand everything about the structures of the cardiovascular system. Broad strokes, absolutely. You need to know heart, pericardium, arteries, veins, and make really good notes in your manual. However, what we need to understand about the national exam is it is broken down by series. So if you go to the AAPC website, you will see that there are, instead of them saying, oh, we're taking 5 questions from respiratory, 5 questions from musculoskeletal, 5 questions from cardiovascular, what they'll say is, we are taking this many questions from this series. So we're looking at cardiovascular, we're looking at the 30,000 series, okay? So that means that all these codes start with 3, all right? So that's the 30,000 series. But what you'll also note is that the 30,000 series is not exclusive to cardiovascular. It's also respiratory system. It is also lymphatic and hemic, and it's also diaphragm and mediastinum. So there are multiple systems that we address when we talk about the 30,000 series. There are a lot of codes and a lot of different structures that we could be talking about when we say 30,000 series, okay? And based on what the AAPC has decided for the newest exam is that there will be 6 questions from this series, okay? So 6 questions from respiratory, cardiovascular, hemic-lymphatic, mediastinum, and diaphragm all together, okay? So that means it's unlikely you'll have 6 questions just from cardiovascular. You might have 2 or 3 or something like that. But you will not have all 6 because we've got to get some representation from respiratory and the other systems as well. But very, very few of your questions on national exam are going to be exclusively from the cardiovascular system. Does that mean you should just give up studying this? No, absolutely not. But you do need to have a reasonable strategy. And so my strategy, which is going to be unpopular with a lot of coders, but I don't care because I just want you to do well, is look up the answers. Right? There's the big secret. You are talking about a multiple choice test. Each question has 4 answers. If you see, hey, we're talking about cardiovascular system, I think it's worth your time just to go ahead and look them up each answer. And that's going to hopefully alleviate a lot of your anxiety about having to totally understand the system, and also going to save you from using this very complex, long table of contents, okay? Which is excellent if you're working heavily in this section, but if you have 2 or 3 questions on a national exam, it's really not going to be a good use of your time, okay? Look up the answers. It's okay. And, you know, like I've said many, many times, I'm not teaching you how to be a coder. I'm teaching you how to pass the national exam. You will become an expert coder from working as a coder, all right? We are focused on mastering this manual and being able to quickly and efficiently find specific codes, all right? So go ahead and make a note for yourself, do whatever it is you need to do, but go ahead and look up each option. Okay, it's totally fine. You have a pass, you have my permission. But I really think that that is your best bet. And will help you not get so overwhelmed with this section, which is very complicated. And then, like I said, look at those strategies we talked about. Make sure you understand the parentheses. Ooh, that's getting too bright. That this section is heavy into parentheses and parenthetical guidance. Okay, make sure you understand that, and make sure you know what structure you are working with. Based on the documentation. Are you talking about the aorta? Are you talking about the mitral valve? If you are looking at veins, which vein are we talking about? And then make sure that matches what is listed in your code, okay? That's really going to be your best bet. Of course, if you have no idea which section you're even looking at, you're totally confused, of course, you can go use the index as well. But if you know you're working in a section and you feel like that's going to freak you out, please just look up each option. It will be fine. All right. So that is all I have for this section. And I will post additional resources and all of that. And feel free to ask questions in the discussion, and we can go over whatever your concerns might be from this section. All right. Thank you all. Bye-bye.